So we are letting folks in. Welcome. Good evening, everyone. I'm going to leave my sound on in case you can hear other folks participating in the noise barrage. Again, for folks that may not know about the noise barrage, it's every 7 p.m. Folks make noise, clap, have like noisemakers. Pots and pans has been a really easy one to express our gratitude to all the frontline workers all around. And for me, it's been a really rewarding way of motivating myself to step out, get some fresh air, and even connect with my neighbors. So across the street, I've even seen like a young person also like got like some kind of shaker of some sort. And it's really cute because she waves back at me. Oh, I'll just leave it there between these two. Again, welcome everyone to the webinar. This is hosted by NAFCON, the National Alliance for Filipino Concerns. It is a part of a web series that we are hosting along the campaign for Bayanihan response to COVID-19. My name is May, and I will be your co-host for this evening. This is our second webinar in our series, so really excited to have you all here and to take this time together. Mike Luat, do you want to say hello?
Hi everyone. My name is Michael Watt. I am the other part of the co-coordinator. Yes, this is the second part. I'm actually glad to introduce that we're actually going to be coming up with a little bit more. Stay tuned. Towards the end, we're going to promote those upcoming webinars. And do participate in the noise barrage.
Welcome everyone to NAFCON's second webinar. Let's see here. We will be starting hopefully in another, I guess, let's hang tight a little bit. It seems like there's still more folks that are coming through. Let's see. Hi, Laura. Your doggy's so cute.
Hi. It was jumping on my lap.
Oh, how precious.
Hi, May. Hi, Mike. Hi, Lara.
Saki.
Hi,
How's
Saki.
it going?
Hello.
No, that's okay.
Mike, I wanted to ask, do you think we should start the opening prayer in 5 minutes? Does that sound good? Or do you want to start sooner than that?
I think we could start in the next, well, probably like 2 to 3 minutes.
Okay. Sounds good. All right. We will start in 2 or 3 minutes, everyone. I'm sharing here my tambourine and my maraca that I typically use when I go out on my second floor. I have a metal banister, so I just bang it all along, and it's my walking and exercise too, where I just kind of walk around the banister and make a lot of noise. This artwork is made by Cecilia Lim, and Mike, do you know how to say this? Pagbigay pasalamat? Did I say that?
Yeah. Good, thanks.
Yes. And Father Bong, we will get started in another 2 minutes, just letting you know. Let's see. So again, everyone, welcome to the webinar, the NAFCON's Northeast second webinar on trials and tribulations, COVID-19 experiences. So we're just giving some time for folks to come back in from participating in the local noise barrage, being able to connect and uplift others, to express our frontline workers. So we were kind of clapping for those who weren't able to get up, we were clapping. But we'll get started in just a few, and we will be having an opening prayer before we get into the webinar. Again, just letting everyone know they're going to be on mute for the most part, and that we do have a question and answer portion towards the middle of our program. Mike, could you help me with some of our what is it called? Our ground.
Our etiquette.
Yes. Is that somewhere
Sure.
here? Oh, there it is.
Yes.
Okay, yeah.
Yes. So again, we are muting everyone unless you are speaking. Please, if you do have any questions, you could always type it in the chat box under more. If you go to more, you click it, and then I believe there is a red thing that says chat. Or if you are on a computer, it's Alt H. So if you go to Alt H, it'll pull up the chat box. There, we kindly ask you to actually introduce yourself. If you're a part of an organization, put your organization there, and then also your pronouns. We just want to acknowledge everyone correctly with the proper pronouns that they go with. And then again, we just want to reiterate, we are recording this. This is being live streamed. It's on Facebook. So hello, Facebook friends. Say hi to them. And this is also going to be uploaded on YouTube, our NAFCON .ne YouTube channel that we have, just because we want to actually publicize this out to the public and inform some of our kababayans all these things that we learn about COVID-19, so we can actually protect ourselves and our community.
Thank you, Mike.
No problem.
So I would like to go up. Let me just double check. There's a couple. These were some announcements we were, sharing. Maybe I'll show that video a little bit later. And so I would like to welcome Father Bong, who graduated in AB Poli Sci from Adamson University, Manila, graduated with a BA in Theology and Master in Divinity from St. Andrew's Theological Seminary in Quezon City. He is an ordained priest of the Iglesia Filipina Independiente, aka the Philippine Independent Church, the only church in the Philippines that was born out of struggle of the Filipino people against Spanish and American domination, the only nationalist church that was proclaimed by the Union Obrera Democracia, UOD, a national federation of labor unions in the Philippines founded by Don Isabelo de los Reyes Sr., and is a current missionary of the IFI and for all Filipino migrants in New York and New Jersey. So if you can, welcome Father Bong to give an opening interfaith prayer.
Let us pray. Omnipotent, omniscient, and omnipresent God, the Father, Son, and Holy Spirit, the Blessed Trinity, only in you we can find certainty and hope. Only in you we can feel love and comfort. Only in you we can find genuine joy and peace. For you are the only one who can heal the broken heart. You are the only one who can heal all kinds of diseases. And you are the only one who knows very well of our feelings the condition of our life, and even our thoughts. For our thoughts are your thoughts, and your thoughts are not our thoughts. We, your humble servants, are here gathered virtually to discuss our present trials and tribulations brought about by this deadly COVID-19. We are here to share our thoughts as to how we should keep ourselves safe and healthy, and how we should extend our service to our brothers and sisters, even in a simple way, especially to our fellow Filipinos in the United States, particularly here in New York. You promised to your disciples that whenever 2 or 3 are gathered in your name, you will be in the midst of them. Be with us now in this gathering. We beseech you, O Lord, and grant us your wisdom that we may arrive into a wise decision for the welfare of your people and for the advancement of your reign kingdom on earth. In your mercy, O Lord, we ask your Holy Spirit to touch all those who are infected by this coronavirus, drive away their sickness, and restore them into good health. Protect and strengthen all the frontliners from this infectious disease, especially the nurses and doctors, that they may continue to attend their patients and use them to discharge your healing power upon all the patients in order to save their lives. Send also your Holy Spirit upon all the leaders of the land, particularly in the United States and our native land, the Philippines, that in this time of pandemic, they may set aside all political interests and indifferences, but instead they should unite in fighting against these invisible enemies and in attending the needs of the people with true compassion and love as taught by our Lord Jesus Christ. We ask you also, Lord Jesus, to guide and bless all members of the National Alliance for Filipino Concerns and the volunteers of Bayanihan response to COVID-19, that they may continue to serve your people, especially the needy, in compliance to your command in Matthew chapter 25, verse 40. Whatever you did to the least of your brethren, you have done it to me. Above all, Lord, we humbly ask you to intervene now in our miserable situation. We believe that this coronavirus is neither of your own act nor of your own will, that millions around the world would get infected, died, starved, or natural. As all-knowing and all-powerful God, we believe that you have all the power to wipe away this COVID-19. And we know that in these trials and tribulations, you want all your people to reflect, repent, and return to you. With humble and contrite hearts, we beg your mercy, O Lord, to please intervene now. Please exterminate the coronavirus and heal the world. All this we ask through our Lord Jesus Christ, our great healer and redeemer. In the name of the Father, and the Son, and of the Holy Spirit. Amen.
Amen. Thank you, Father Bong, for sharing that great prayer. It's really grounding after a long work day to center myself and all of ourselves. So I'm going to share a video that we debuted on Sunday, which was also Mother's Day. Without further ado. Is the sound on?
Para sa ating mga nurses, healthcare workers, frontliners, para sa ating mga ina, mga tumatayong ina at mga tagapangalaga sa ating lipunan, at para sa ating inang bayan.
To all the mothers who are nurses, healthcare workers, caretakers, essential workers on the front lines, maraming salamat po.
To the frontline workers, healthcare workers, and mothers, thank you so much for your hard work and dedication to others.
Thank you.
Thank you!
Thank you. Thank you.
Thank you for all of the hard work, care, and love you have given to our communities. We will get through this together, and I'm sending you all of my gratitude and love.
Karing kalupa kong health workers, karing aganaganang frontliners, ampong, karing aganaganang indu, king neto yatu, takala salamat kay kongan.
Kadagiti aming health workers, frontliners, kanina, agyaman kami kada kayo.
To all our healthcare workers, frontliners, and mothers, thank you.
Thank you for all the amazing things that you do.
Thank you.
Thank you.
Damo nga salamat.
Dakal pong salamat. Mabuhay po kayo.
Thank you. Thank you. Thank you. Thank you. Thank you.
So nice. And again, we had a virtual concert on Sunday. NAFCON USA hosted a virtual concert, and that was when we debuted it. But it was really nice that Northeast, we were doing a lot of things on Mother's Day, and that we made it into a lot of the photos. So next, I'd like to pass it on to Mike.
Sorry about that. So hi everyone. I just wanted to reintroduce this. Again, we are doing as a part of the Bayanihan response to COVID-19. We are actually doing this another webinar, which is called Trials and Tribulations. And this is another part of another series. I think the next one that we do have is the mental and holistic health. And then after that, we're also going to do one about unemployment. So, you know, you can actually, you know, RSVP it. We're going to be putting it up soon on our Facebook. So stay tuned, and our Instagram. So stay tuned to those things. You know, we hope to see more. Again, we are also putting this on YouTube as well. All right, let's move to the next one.
Oh, I'm sorry.
Again, we just went over the etiquettes. We just want to remind people that everyone is muted. If you have any questions, type it in the chat box below. And also too, the webinar is recorded, is being live streamed. It's going to be it's on Facebook right now. And we are going to be posting it up on YouTube in the next few days. And then if you have any questions, put it in the chat box. Please introduce yourself, your name, your organization, and your pronouns as well. Okay, so the objectives for the webinar are to, one is to, you know, listen to the testimonies and experience of the COVID survivors, and to provide educational resources around where we can get testing, you know, when and where you can get testing, how undocumented communities can actually access some of these treatment, and provide accurate and reliable information to the Filipino community. Also too, the last point is to come together in the spirit of Bayanihan and provide action oriented initiatives to support our kababayan. So action meaning to say led by our community, so that we can actually help our own community out together. And so the program, basically we just went through the introduction. We'll be going through the introduction NAFCON. For those that are new today and joining us, we'll give you what NAFCON is about, the updates of you know, our COVID response campaign, and some of our victories there. Also too, we're going to do information sharing of resource speakers. So the first one is Aries de la Cruz, who's going to be going about the city resources and how, you know, how we can access that. Stephen de Castro, Luis Felix are going to be talking about their experiences of COVID-19. one from the point of view of going to the hospital, going to the ER, and then the other one is based on some challenges, possibly getting healthcare coverage or whatnot due to their orientation. And then lastly, Dr. Catherine Alcaraz is going to speak about just some other things about COVID, any updates and things like that. We're gonna have our Q&A, and then we're gonna have a call to action in the closing.
Thank you, Mike. Let's see here. Also sharing a disclaimer, just letting everyone know that, this is our second webinar, and the intention of this webinar is really to share what we know as a community, shared knowledge. So recognizing that this is educational purposes only, and that this does not serve as medical advice in the treatment of COVID-19. I think this is still. So just letting everyone know, NAFCON, the National Alliance for Filipino Concerns, we are Filipino organizations, institutions, and individuals that respond to concerns for Filipinos in the U.S. and the Philippines by creating an action-oriented platform that brings people together through culture and heritage, education, health and wellness, and advocacy. And we are located in all of these places nationwide. If we aren't there and you know of folks that are possibly interested in starting up a NAFCON, please get us in touch with them, and we would love to get other chapters in the U.S. Started up. Again, sharing our pillars. We, like I said, we're really grounded in pillars of culture and heritage, education, like what we're doing right now in this webinar, obviously around health and wellness, clearly COVID-19, the pandemic, and being able to sustain ourselves under this current situation is very important to us, as well as advocacy. So really looking at, all these pillars are pretty intersectional, that they all can influence each other. As Filipinos, these pillars can definitely bring to light our own experiences as Filipinos. And so if you agree with any of these pillars, you are able to be an affiliate of NAFCON. So the unities are empowerment of Filipino communities in the U.S., preservation and celebration of Filipino culture and heritage, the promotion of rights, health, and well-being of Filipinos, and the advocacy for Filipino communities, both in the US and in the Philippines. So I'd like to pass it forward to Mike.
Hello again, it's me. So we're gonna actually start jumping into the some of the aspects of what's, with the updates of what's been going on with the Bayanihan response, some of the successes we've achieved so far. So yes, we'll move on to the next slide. Okay. So, yeah. Oh. Okay. Okay. All right. So basically, through the campaign, we were, these are some of the things that we try to achieve. Is one, to deliver resources and services to our community, especially the impacted communities. We again disseminate accurate and reliable information to our community, and engage the community in a campaign with a collective Bayanihan spirit. And lastly, to collaborate with grassroots organizations and services institutions, private entities, and government agencies. Just hence why we have Aries helping us out today. All right. And so these are the components of Bayanihan response. We do have like 5 committees there, which is research and education, services, action and advocacy, um, resource. I think it's resource mobilization, as well as what NAFCON is doing. These are some areas that we in, kind of encourage our community to come and actually partake in, especially if you are a person that does like resources for, the city, or you are a medical professional that wants to contribute back, or a lawyer. You could join any of these committees that could use the help.
Yeah, can I also add that what has been also really powerful about people joining these different committees is that, each and every one of us has some sort of shared knowledge that we can contribute to these different things. So even if it feels like it might be just like something small, like being able to make phone calls for someone, or helping with doing some emails, or
Yeah, if you're a good writer.
doing a delivery for a neighbor, and even also just trying to do research to find out what are the working conditions. If we're not all going outside, maybe someone would be interested in like really finding out what are the issues of healthcare workers, essential workers, et cetera, et cetera. And so, yeah, just adding to what Mike had shared is that, please find a way for you to feel empowered to contribute to any of these
or you're really good at drafting emails and for like outreach purposes and things like that. These are things that we need more people to staff that. So we actually we're actually looking around for folks who would actually use their skills and contribute back to the community. All right. Okay, so basically, some of the things that we've done is we've fundraised, like $2,000 worth of PPE, and other like food and other supplies. We've received donations from people who redirected their like stimulus checks to the Bayanihan efforts. Um, we also have procured and delivered over 2,000 N95 and K95 surgical masks, and other face masks to nursing homes and hospital workers. Um, we have also assembled a delivery package called the Ingot Care Package, which contains groceries and basic ingredients to the most vulnerable in our community. Basically, for those who can't leave their homes, we've run errands for, and afford like basic necessities. So including like the undocumented workers who have lost their jobs due to COVID-19. As you know, like some of the J1s are here. They're, what it is a special visa to come study. But however, some of them are working, and due to COVID-19, they lost their jobs because the economy has slowed down to the point where some of their employers no longer needed them. So, one of the things that using the Bayanihan spirits, we're actually giving back to the community, just so that they can feel like they are supported. And then also too, I also want to talk about like we delivered about 150 meals to 5 different units and facilities. Oh, that's the next slide, May. Oh, okay. So we actually paired up with a group called Meals to Heal. We've actually delivered to like 5 different units and facilities. One is to like Elmhurst Hospital, the Rogan Institute of Dialysis Center, and the Regal Heights Rehabilitation Center in Queens. In our partnership with the Heels to Heel. We wanted to ensure like small, restaurant businesses in Queens, little Manila, like Kababayan and Tito Rads are, taken care of just because this has affected a lot of like the restaurants all up and down Woodside, and we wanted to give that support back. And then some of the other things too, we've conducted intakes with our community members, referring to like certain services. So basically, what we have been actually doing is actually referring back to like seniors who can't leave due to like this pandemic that is happening. We've actually, received about 20 plus calls from seniors that are out there who are vulnerable and don't have any food. So we actually linked them up with the city services for like it's called NYC Food Resources, and we got actually some deliveries to them. What is happening is they are getting 3 days. Every 3 days there's a delivery for 9 meals, which is like 3 a day, and it goes for like up to 2 people.
Thank you, Mike, for sharing that. We can definitely provide more resources in the chat, and we'll also put it in the email as well. So I would like to get started in being able to hear from our resource speakers. We have 4 resource speakers this evening. And what we'll be covering is, what are the trials and tribulations and what are the experiences that folks have been having around COVID-19. So some of the things we'll be addressing are, what do I do when I have COVID-19 symptoms? What are resources available in New York City? And we'll be hearing from testimonies from COVID-19 survivors. Mike, can you please introduce Aries?
I'm happy to introduce myself. So my name is Aries de la Cruz. I'm the press secretary for the Manhattan Borough President. I'm also one of the co-founders of the Filipino American Democratic Club of New York. My parents brought me to the United States when I was 7 years old because they wanted me and my family to have opportunities for democracy and freedom and economic opportunity. And so I've dedicated my whole life to making sure that all of us in this city, in this state, in this region, have those same opportunities. And so I'm dedicated to making sure that you all know how best to make the best out of this messy, vibrant democracy that we're in. And so that's why I'm really happy to have been invited here today by Mike Aravias and NAFCON Northeast, May, and Michael Luat, and all the great folks at the Bainian Project and NAFCON Northeast. And so I'm here today to go over some of the resources that are available to all of us who are at least here in New York State, in New York City. And I'll start off with the state resources. So that's the next slide. But before I do that, I just wanted to go over just some quick numbers. So far in the state of New York, there have been 100,000 people who have tested positive for COVID-19. In the past 24 hours, about 1,100 have tested positive. Again, that's within the past day. And there have been 166 deaths, fatalities statewide. One indicator is the daily number of people admitted to our hospitals is up to 78 today. Yesterday it was 51. The daily people in ICUs is also up, and this isn't just in New York City, just by a small amount, from 550 to 561. The good news is that the percentage of people who tested positive citywide is down from 14% to 13%. So one of the big things I can let you know is that the deadline to apply for health insurance has been extended. Normally it's April 15, but it's been extended to June 15. So you can access the state health website there at nystateofhealth.ny.gov. If you're interested in getting tested and screened for COVID-19, you can go to covid19screening.health.ny.gov. Those places will also direct you to some of the drive-in and walk-in centers throughout the state, including in New York City. And I'll talk about some of the city testing centers shortly as well. If you have any questions at all about COVID-19, there's a hotline that's staffed by public health professionals, 888-364-3065. For those who are having just struggling with mental health. I know it's something that we all have to deal with, certainly in this environment. There's a helpline there that it's free, 844-863-9314. And you can also go there and see there's also online electronic resources that you can go to if you go to that number. If you're a frontline worker, the state has also contracted to have a text line, particularly for healthcare workers, first responders, and that kind of thing. If you need emotional support, just text NY Frontline to 741-741. There's also a domestic violence hotline. Of course, the most important number to call is 911 if you're in any danger, but you can call 800-942-9606, or you can also text to 844-997-2121. A lot of the information, but interestingly enough, not all of this information is available on the centralized website for New York State, health.ny.gov/diseases/communicable coronavirus. And you can take a screenshot or with your phone of this, and then we can move on to the next slide. If you know of any price gouging, that is, if somehow the price of milk has tripled to where you are, you can report that to 800-697-1220. That's the Attorney General's hotline. If you know people who are experiencing discrimination and workplace harassment related not just to COVID-19, but we know there's a lot of anti-Asian and anti-LGBT violence, which is on the rise, you can go to DHR, the New York State Department of Human Rights website, to report it. If you believe that your employer is in violation of already existing labor laws or any recently issued executive orders, like social distancing and providing PPE and not, providing you with sick leave and things like that, you can call the New York State Attorney General, Letitia James at 212-416-8700 or labor.bureau@ag.ny.gov. That's also to report businesses who are not essential businesses that are operating. Businesses that are operating who are not in the list of essentials are subject to civil penalties of $1,000. If you're an essential worker traveling between 1 a.m. to 5 a.m., you may know that the subways are closed, but you are eligible for an Uber or a Lyft or some kind of for-hire vehicle or shuttle van or express bus that's provided for you free by the MTA. And you can go to new.mta.info/coronavirus/overnight. If you're a healthcare provider, if you're a nurse or a doctor, the New York State Department of Health does a weekly webinar for all the healthcare providers in the state, so they can log on and learn about what's new from the state and what new things to expect and communicate their concerns. If you are working in a hospital or a nursing home, or if you're a primary care provider and you need PPE from the city, you can email supply request at oem.nyc.gov. So again, if you're a healthcare worker, or if you have a friend who is a healthcare worker, you should really take a screenshot or get that email address. You can request PPE. As for the numbers of people who are tested, the fatalities by county, data of that nature, people who have recovered, where the hotspots are, the state has a COVID tracker. It has a lot of the data there, ny.gov/COVID-19 tracker. If you have a family member in a nursing home and you're concerned about the care they're getting, you can call the state complaint hotline 833-249-8499. If your employer is not allowing you to have sick leave, or you need the forms to be able to get sick leave if you have COVID-19, For your employer, it's 844-337-6303. You are eligible for paid sick leave if you contract symptoms of COVID. If you want to work for the state, getting these contact tracing jobs, that's the website coronavirus.health@ny.gov/get/involve-how-u-can-. For people who are interested in knowing about when we are going to reopen parts of the state, at least two regions, or I think 3 regions of the state are slated to open partially starting this Friday. And each reopening is actually phased, so there's different industries for each phase. The New York City has not yet reached the metrics needed to hit the reopening. We have about 4 out of 7 benchmarks that we've reached, but the 2 or 3 other regions upstate, which are practically in Canada, they've pretty much reached those metrics. New York State still has, I think, a rate of about 3 or 4 infections per 100,000 people. And so once we get that down to 2 or below, that's when we can hit those benchmarks to be able to reopen. So that's forward.ny.gov. That's the reopening plan. It's got tips in there for businesses on when to reopen, and you can also keep track of how close we are to the governor allowing a region to reopen. Next slide. So for the city of New York, there's a central page for resources, nyc.gov/coronavirus. If you're interested in city testing, again, the state has facilities in the city, but so does the city. It's nyc.gov/COVID-test. If you're interested in working for health and hospitals, working for these COVID tracing jobs, the contact tracing, nyc.gov/trace team. If you're affected by COVID-19 and you need things like food stamps, housing assistance, food assistance, rental assistance, health insurance assistance, any kind of assistance, all the things that you are eligible for, you just go to access.nyc.gov. If you're LGBTQ, the city has just released a guide, I think today or yesterday, that has a list of resources that you can go to that have shown to be LGBTQ affirming. If you are a healthcare worker, or if you are not a healthcare worker and you have symptoms of COVID and you live with family members or many people in your home and you cannot quarantine within your own home, the city has 11,000 hotel rooms that we have now provided to be able to help you quarantine during that time. The city also believes that no New Yorker should ever go hungry, and so they're committed to providing 3 million meals per day. They're ratcheting that up from, right now it's about, I think, 1 million meals a day. They're working on providing 3 million meals a day, which is a big lift considering it's a city of 8 million people. So there's food deliveries, there's food pickups. Many schools have many days supplies of food available, and it'll also deliver it to you if you are a senior citizen or if you're immunocompromised and cannot leave your home. They'll also provide that for you, and those food options are also available in halal and kosher. If you're a pet owner, there's some assistance that's provided as well in terms of pet food and things like that. The hotline is right there. Next slide. And if you are here, if you have a DACA certification, if you have questions about it, or if you need help paying for your DACA renewal or application, you can call that phone number. For other services that are available for immigrants, I think we recently announced, I don't know the exact amount, I want to say $500 or $600 for undocumented people who are not able to receive the economic stimulus that's provided by the IRS. You can learn more from the Mayor's Office of Immigrant Affairs. Again, for further testing, hotels, you can go on to the next slide. Again, for city-based domestic and gender-based violence, you can call to report price gouging in New York City, and yes, you can also use the earlier website, but that's the price gouging URL. If you need financial counseling, talk money. Mental health, you can chat, you can text, you can talk to a mental health care provider for free. If you're experiencing discrimination in public housing accommodations or even employment, particularly I've heard some cases of like where landlords are like worried if you're older or if you have COVID-19, your landlord's trying to pressure you to leave, you can actually have a discrimination case open against that landlord. We can move on to the next slide. As you know, there is a federal stimulus part 2 being worked on. It's just been passed in Congress. It includes $17 billion for New York City, $375 billion for counties and localities, $34 billion for New York State, with $500 billion total for all states, $10 billion to support the increase of food stamps, $4 billion for housing, for Section 8 vouchers, that's for people who are homeless, $15 billion for transit, federal benefits for first responders who died related to COVID, and $200 billion to establish hazard pay for essential workers, including a $13 hour premium on top of people's wages up to $10,000 from the federal government. However, next slide. However, while that is passed in Congress, it still needs to get through Senate. So I'm going to share the Senate number soon and encourage you guys to call that. In the city of New York, there have been 82 cases of pediatric multi-system syndrome in the entire state. There's about 102. These children are predominantly school-aged. It's taken the lives of 3 young New Yorkers. There's a 5-year-old in New York City, a 7-year-old in Westchester County, and a teenager in Suffolk County. Of these cases, 60% of these kids displayed symptoms related positive for COVID-19, and 40% tested positive for COVID-19 antibodies. 71% and 43% of these 102 cases, they remain hospitalized. So there's still like 50 kids in the hospital as we speak. So you should seek immediate care if your child has prolonged fever of more than 5 days, severe abdominal pain, diarrhea, or vomiting, and bloodshot eyes or skin rash. And if you don't have access to a primary care provider, you can call 311 and they will connect you to free healthcare. And so finally, if you would like to see the stimulus passed, it got passed in the Democratic-controlled House, but the Republicans still control the Senate. So you can call your senator, you can call this and say what state you are, and they'll tell you the names and phone numbers of your 2 senators, and tell them that you support the federal stimulus that's been passed this week. So I'm happy to answer any questions after this webinar is over. You can also reach me on Facebook, Twitter, anything like that.
Thank you, Aries, for sharing that with us. For folks, we also have a Q&A in our program after all our resource speakers have shared. So if you do have questions for Aries that you'd like answered now, just put them in the chat, and our when the question and answer portion comes, we will definitely have your answer or have your question answered during that portion. So please feel free to continue to ask questions in the chat. And again, all the resources that Aries has shared, we will make sure to email all the folks who have registered for this webinar so that we can continue to learn more about these resources. But even from everything you've said, Aries, I am learning so much more. So, I mean, just when I think I know enough, there's so much more to be learned. So thank you again.
Absolutely. Thank you for having me.
Yeah, where's my hotel room? Yeah, I've got COVID. I want the, I want the Hilton. Yeah. But okay, well,
Steve, going into you, I would love for you to share, just to introduce yourself or to introduce you. You're the director, teacher, and cinematographer of award-winning film Revolutionary Selfie. When you're not directing your own projects, you're also working as a cinematographer for other directors in narrative and documentary films and shorts. But before you were a filmmaker, you were also a trial lawyer and served as Human Rights Commissioner of Jersey City. So, Stephen, if you would like to share again, I might need to let me know when you want me to unshare my screen so that you can share your screen. Let me know.
Oh yeah, okay, sounds good. I think that we'll just launch right in. And so if you could give me the screen, and I'm just gonna show you guys some video, and then we'll talk about it. And then I also have about 5 slides to go through, and then I'll give it back to you guys, and hopefully we can have a very active Q&A session as well. Okay, hold on. Oh, wait a minute. I didn't check something. Okay, that's good. Okay. So, this afternoon when I went to Elmhurst, I just went into the emergency room. I almost fell to the floor. I was so having some type of respiratory difficulty. And here I am. And they've been doing some tests, doing x-ray and electrocardiogram. And but yeah, it's I'm shocked how calm everything is actually. How nice the doctors and nurses are when they have so much they need to handle. And I can't tell you how impressed I am. But I'll give you guys, I think I'm doing okay, but I have to get my test back, but the doctors think I'm gonna live through this. Okay, I'll talk to you guys later. Okie dokie. And so that was my first day in being admitted to the emergency room. It was about late March, and stayed there for about a week. So I was in Elmhurst Hospital emergency room. I saw really tough cases at that time. There one of those days, it was like one of those world record-breaking days in terms of COVID-19 in New York. And I reached out to people on Facebook. I reached out to, everybody who is on my Facebook. And if you were one of those people who helped out or covered it or sent a nice comment or texted me or called me or anything, or just read it or watched what I was going through, I really, really thank you. I really appreciate it. So I'm a filmmaker, and it's kind of wild because around that time I also had completed my training as an EMT. Believe it or not. Not that I really wanted to, my plan was not to drive an ambulance, but I completed medic training because I'm preparing for my next movie. And so that medic training will assist me in getting doors open for my next movie. And so I got the impression that we were talking about some real practical things. So I'll just go practical. I'll just go through my slides real quick. Okay. I think that's it. Oh, wait a minute. You don't see it yet. I forgot. I got to share it again. No problem. All right. We'll go with that. Okay, great. So, let's see. At first, it was a big decision to go to the emergency room or not. Most people who have our disease, coronavirus, that they are sick for a while. You might. I had suspected I had coronavirus for about a week beforehand and had been staying at home, isolating myself. And so at what point do you go to the emergency room? And usually it's a pretty easy decision anyway, but the number one is when you can't breathe anymore, really. When you have that respiratory distress, you probably could hear it in that video that I showed you. But also you gotta be careful of the heart attack, signs and symptoms of a heart attack, because I think Aries could probably tell you that the number of people who are found dead in their homes in New York City during the same time went up from it used to be an average of about 30 people per day, and it went up to 200 people per day. And these are people who never got into any statistics for coronavirus fatalities, but there was a good chance that those heart attacks, those people who died, were victims of coronavirus. And so, of course, we know it affects the lungs, and the lungs are attached to the heart. Pulmonary system is cardiopulmonary system, and so therefore, you have to watch out for the signs of a heart attack. And for children, rash and inflammation. I think Aries just went over that. And also, if your oxygen saturation is below 90%. It used to be that you can get an oxygen saturation meter. It's a very simple device. It used to cost like $9. I got mine for like $9, and it can measure your oxygen saturation. So acute cases, that oxygen saturation drops to below 90%. Now these oxygen meters called pulse oximeter, if you're interested, it's called pulse oximeter. And these things are selling on eBay for like $57 or something like that. Okay, going to the next. Okay. So rashes, so these are really good photos of what this type of rash is looking like. It's a brand new thing that people are seeing. So these kids are really suffering from this stuff, and it's important to know that we're going to have a second wave, and so unfortunately we're all going to have to be looking at these signs and symptoms in ourselves and in others real soon. Like what Ari said about, we only got 70 people going to a hospital today. That sounds really encouraging, but we have to be vigilant related to these things. Okay, going next. Okay, yeah, so another big issue was what to bring to the ER, because of course you do not know when you're coming back. So an important thing is the cell phone and charger. Of course, it's important. People can't tear themselves away from their cell phones anyway, but we got to remember with coronavirus, there are no visitors. So, there is internet in the hospital. And as you saw, I was able to use my cell phone to communicate to others. And it was really important. It's important to keep your spirits up. It's important to keep your spirits up in the ER, believe me. I could tell you a whole lot about that, but we're almost out of time. Then also it can get cold. So, I bring like a winter hat, something warm to wear, because if you're in a bed and it's cold, it can be rough. So it's already rough in the ER because you have blinding lights. You don't know how long you're going to be there. And so I was like 3 or 4 days, no sleep, because, it's hard to keep your eyes closed with those blinding lights. And then going next. Oh yeah, leaving the hospital, something that I did not consider. I think Potri is on our group here, but how to leave. So they told me, keep your social distance and don't be near anybody and so forth. But then it's like, how do I get home? And so we were having a lot of trouble with that. I think that our mutual aid support groups can help to assist. And I would like to volunteer to help to get coronavirus patients out of the hospital and back at home. They are not sure if I'm immune, even though I've had coronavirus, but I figured that I'm more immune than most, and I wouldn't mind giving a hand. Okay, so just a little happy ending. After I got out of the hospital, before I got into a hospital, I had started a fundraiser. This is not a big thing. This is just like a little Facebook fundraiser where I was trying to raise some money to get some masks over to Elmhurst Hospital. And so my goal was to get 1 box of masks. These masks are pretty expensive. It's like $250 for 1 box. So right when I was able to meet the goal, somebody else kicked in some money, and then we just decided to double the goal. And thankfully, some folks from Sige were able, since I was not able to get up in my I was in bed for after the ER. I was in bed for like a month, all the way down the entire month of April. I was on my ass. So so the folks at Seagate were able to convey these important this important gear over to Elmhurst, and I really appreciate it. I'm going to give the screen back now. Let's see. Okay. Oh yeah, just that top button. Boom. Okay, great. And so thank you guys. I'm a little bit over time, but all I would like to say is we got to stay positive and stay encouraged, because one thing that helped me is that having finished Revolution Selfie, and I felt that at that time I kind of fulfilled a certain unique role for the folks who are outside of the struggle of the Philippine Revolution, outside of the operating areas of the NPA, to be able to spread the word and to participate in the struggle in that way. And I thought just because of the movement, because there's a lot more work to do, and because I'd like to continue to participate in that, that's something that keeps you going through these hard times. I think for all of us, and so keep going, keep it up, and thank you guys.
Thank you so much, Steve. Really appreciate sharing your insight and figuring out when you were coming out and being able to contribute back to Elmhurst Hospital. That was really wonderful. Mike.
All right. So our next speaker, their name is Louis Felix. They're a queer transgender male, born and raised in Brooklyn. They're a co-founder of the End is Queer, which is an NYC mutual aid group on Facebook and Discord. In their work life, they work as a mental health crisis respite, as a peer counselor, and most of the consumers are somewhere within the intersection of elderly, disabled, and homeless, by BIP OC and HIV plus, and or people with a drug that uses drugs as for mental addition to being mentally ill. The population and the people who they work with are still continue to be hit by the hardest by COVID-19. So with that, here you go is Louis.
Hello, thank you so much for having me. I'm very honored to be here and to be speaking to all of you. I can only speak for myself and somewhat for what I've been seeing and hearing. I started getting worried about COVID back in February. Most of the mental health respites in New York City are particularly vulnerable to disease even before COVID-19. That's because we work with a huge amount of homeless, street homeless, people who are HIV positive, people who use drugs, and it can be a vector of disease even if it's the common cold. So I was concerned in February that myself, my coworkers, people that work with homeless people would be among the second wave hit. The first wave hit, people who need to be in homeless shelters. And that has continued to be a very, very hard hit part of New York City, because it's a combination of not just poverty, but if people don't have access to be able to take showers, to wash their hands, if people already don't have the best resources to keep themselves sick before an epidemic, then during an epidemic just really highlights the kind of failures of our current city in making sure that everyone has somewhere safe to be, and enough food to eat. I got sick in the beginning of March, and that was before the city was shut down. I started calling out of work on March 8th because I was very, very worried of passing. Excuse me. That's the oven. My roommate is baking sourdough. I was very worried about passing COVID on to many of my coworkers. I work in a bunch of different populations, especially with people who are HIV positive, and it was very, very important that I advocate not to go to work even before the city was shut down. So I used the rest of my personal sick time to get out of work before the city was shut down, because even though I was not eligible to be tested at the time, and I did call, I spent about 3 hours on the phone trying to get tested. I called the state hotline, I called Kings County Hospital, which is my closest hospital. I called the CDC, I called, and I kind of got put around and around and around in a series of different phone calls due to my insurance status. And I didn't meet the necessary COVID requirements at the time because I hadn't traveled recently and I hadn't been around to confirm positive. Those guidelines have changed very much since March 8th, which is when I was trying to get tested and when I fell ill. The first symptoms I noticed, and I want to kind of take you through my timeline of symptoms because I want to know that, you know, I'm letting you know and I'm giving you all the information possible to be empowered, because the news is getting one story and there are many stories. I was very sore, I was very tired. I had a mild fever, but I didn't start having a tightness in my chest or coughing until about the second or third week of being in a light fever, not being able to think as clearly as normally, and feeling very, very fatigued and very, very sore in my body. By the week and a half after I got sick on March 8th, I was finally able to relax a bit because that's when New York City started shutting down. Excuse me. Thanks for bearing with me. I still have a fever and I'm on week 9 of being sick. So thank you for having me. I'm on week 9 of being sick. My twin sister is a nurse. She works in Manhattan. She's on week 3 of being sick. She had been using the same PPE mask for 3 weeks before she got sick. My twin sister, I can't speak for her, but I can speak with her. The PPE shortage in New York City is in such a dire state, and a lot of people will not agree with my first reaction in this, which is anger, but it's very, very important that we don't just clap for people, but that we advocate for them. And that includes all the wonderful work that you lovely people have been doing in raising money for masks and distributing them where they are needed, and not just to nurses and doctors, but also to orderlies, to grave diggers, to people who do food delivery, to people who work transit, because we cannot just glorify people, we must make sure that they are safe. In terms of symptoms, thank you for coming with me on this wild ride of what my fever decides to tell you. In my 4th week, I started feeling a lot of chest tightness and I was coughing. I was also having a lot of trouble sleeping. One of the silliest bits about the virus is it can make me so sleepy and still prevent me from sleeping. This was largely due to a very hard light sensitivity that I developed in conjunction with my fever, which is common. And the fever, it never went above about 101.5, but it's been staying at around 99.6 and then shooting back up to 100. and maybe it'll give me a day off, maybe about 3 days off before continuing. I've had a cough, and the tightness in my chest, what that felt like, it wasn't so much like breathing through a straw, which is the language they're using in a lot of hospitals. It felt more like someone was sitting on me and they were slowly getting heavier. Maybe they were eating cheeseburgers and just every bite was a little bit more heaviness. I've also dealt with a lot of, my cognition is not so great. Anyone who has had a fever for a long time can tell you that a mental haze is something that can go alongside. I want to tell you some tips and tricks that I've developed, and I want to tell you kind of what's been helping me the most, because these are things that you can hopefully use. In terms of hydration, I have a 1 liter bottle and I fill that and I just sit and drink it all day long. During fever, one sweats a lot more. I've been drinking a steady stream of ginger juice with lemon and honey, and that's really been helping with my fever symptoms and with my digestive symptoms. My digestive symptoms have mostly exhibited themselves in a severe lack of appetite. The second thing that's been helping me a lot is people specifically cooking for me. Because I've been so ill, I have not been able to cook for myself, and I love to cook. Normally cooking is one of my great joys, and I was like feeling bad that I could not cook, but I just didn't have it in me to stand and pay attention and not set myself on fire. So aside from eating a lot of canned goods, it was important to keep my nutrition up. So making sure that my fridge was stocked with frozen vegetables was a lifesaver, because I could microwave those easily. And I reached out to my mutual aid network, and a lot of people have been dropping off pre-made food in big batches. I would say that that is the best thing you can do for someone if you know they have COVID and you don't know anything else about their situation. You know, find out if they have dietary restrictions and drop off pre-made food, because I love to eat, and since I've had COVID, I've lost a fair amount of weight, and I've been force feeding myself. I actually just got prescribed anti-nausea meds. I also want to let folks know that even if people aren't in the hospital, people can be very sick for a very long time. I've had to keep myself out of the hospital, mostly as a matter of necessity. My health insurance, which is tied to my job, was supposed to kick in the middle of March because I had started a new job and I needed 90 days before my health insurance kicked in, and I got sick about a week and a half before that could happen. This is very, very common. A lot of people fall through the cracks of the American Care Act, and a lot of people need someplace affirming where they can go. Normally, I go to the Apache Community Health Center in New York City. That is the Asian Pacific Islander Coalition on HIV/AIDS. They have been able to refer me to the best healthcare I've gotten. But that's in Manhattan, and I live in Brooklyn. And I had a horrendously terrible experience at the urgent care, which is a few blocks away. So I would very much let all my fellow queer people out there know not all COVID testing sites are going to respect you. And I would definitely ask around, whether it's in your queer Facebook groups or whether it's, you know, asking your queer affirming doctor, or whether it's looking up resources. Since I've been sick, I've also helped create the End is Queer, which is a mutual aid group. We're on Facebook, we're on Discord. Unlike other mutual aid groups, I think I'm over time.
Thank you, Louis, for sharing all that. We can definitely share ways to connect. I think it's really creative for you to have like things like Discord and things like that. I really appreciate all that. So hopefully we can connect more. And in the Q&A, if folks have questions for Louis, please put it in the chat. We do have an additional speaker this evening. I'm really grateful for Dr. Catherine Alcaraz to join us this evening. She is still at her clinic and is still seeing patients. She is a primary care physician specializing in internal medicine and been in private practice for over 15 years. Went to med school in Maine and completed her residency in Lenox Hospital in 2005 and has been doing private practice ever since. She's a partner at Manhattan Internal Medicine Associates since 2010 and an affiliate of Mount Sinai Medical Center and New York Hospital, NYU. Dr. Alcaraz's approach to well-being is both holistic and evidence-based, and she ensures that her patients receive the best preventative care and ongoing treatments. Her current experience with COVID-19 stems from treating patients around 8 to 10 a day, and since then the pandemic has started in February, many who have successfully recovered. Again, Dr. Alcaraz has just joined today and is going to do her best to share her experience. I had told her that, you know, this is a conversation. What we're getting out of this webinar is really to share our experiences. So please, without further ado, Dr. Catherine Alcaraz.
Hi everyone. Hopefully this goes through. I couldn't get my computer to connect, so we're good. Okay, and I just want to say hello to Louis. Hi, I'm very queer friendly, just so you know. And if you need help, you know, we actually, you know, I have been doing telemedicine with a lot of my COVID patients, you know, for the last 6 weeks or so. Like I started seeing a lot of, can you still hear me? I don't know if it's still coming through. I've been seeing a lot of sick patients, like with very strange symptoms from the beginning of January and then, you know, February, people that, you know, thought they had just a flu or a simple cold or, you know, sinus infection and or things like that, you know, and then coming back because they're not getting better, other weird symptoms happening. And, you know, unfortunately, you know, we did not have good information coming from Asia, you know, where everything in Wuhan, where everything started. And then also that unfortunately transpired into the CDC, which also gave us not great information about, you know, which really, I feel so terrible because it really affected a lot of, you know, the frontline people because we weren't given the proper protection. A lot of people got sick. Also, you know, just like for you know, high risk individuals like the homeless, the jails, the nursing homes, it's been horrendous as far as infection, as you all know. So, you know, I think it really starts there when we did not have all the pieces that we really needed to keep everybody safe. And also to empower the doctors and the nurses that are taking care of all the sick people to be able to recognize and treat, you know, this condition. So just so you know, I've been, you know, on multiple Facebook pages with other doctors internationally, because we also were trying to kind of figure out what this new, you know, virus was about, you know. You know, that there was so many places we went wrong. You know, we did not have enough testing. They were telling us one thing one day and then telling us something else completely different the next. You know, oh, you only have to test people if they had a history of travel or exposure. Now it's like anybody could have had it or could have given it to you just being in the same room, you know, and respiratory, you know, talking to you and somebody was infected, you know, you can catch it. So, you know, there was a lot of things going on, you know, so I'm so sorry, Louis, that you were not given, you know, proper care. And, you know, what I found in my experience of treating so many patients, like every day for like crazy, it was like every 15 minutes doing a televisit because I'm outpatient. But of course, I kept abreast of everything going on inpatient with all of my colleagues that were treating inpatient. You know, in my experience, I found that treating earlier, early as possible gives you the best outcome, you know. So I just want to kind of I don't want to go over time. Also, I want to have time for questions and answers. I want to stick to, and May, you want me to go through, I kind of took notes of like of the topics you wanted me to present on, or do you have specific questions, or should I break, or can I go into symptoms, new symptoms, things to watch out for? May?
Since we only have a little bit, maybe we will definitely have you answer questions in the Q&A, but maybe just some new updates about symptoms would be good.
Yeah, I'm gonna update you briefly. So, as Louis said, of course, the symptoms start off like initially as fatigue, just so that people are aware in case they have these symptoms. Sometimes it starts off with fevers, chills, body aches, myalgias, like muscle pains. It feels like the flu, but it's not the flu at all. And you feel it's much, much, much worse and very strange. Like the flu, you feel like fatigue for like a couple of days, and then you have some end in sight. But this COVID virus feels like it's never ending, day after day. And some of the other new kind of newish findings, I would say newish because really it was in March when we started associating a loss of smell is very pathognomonic. Loss of smell and loss of taste. Also, some of my patients presented with headaches, very severe like sinus headaches. Also numbness, tingling, headache, rapid heart rate. So they would feel kind of palpitations, kind of tachycardia. And the pain, the chest pain that patients would come in to see me with, they would report it here or here. It was kind of a strange place that we normally don't always, associate with, definitely not with flu. And also before they said that fever was a significant symptom, but not always. You don't have to have a fever to have COVID. So, I'm not sure if people are aware of that, but yeah, definitely loss of taste, loss of smell is very high suspicion for this condition. May, do you have any other questions for symptoms? The new things you have to watch out for too. Young people are coming up with, so just so you know, before they said, oh, old people and kids don't get it. That's not true now. Now we know actually that a lot of 30 and 40-year-olds are actually in the ICU intubated. They didn't have any past medical previous history. And a lot of young people can sometimes even just present with stroke, so neurologic symptoms, or blood clots in the legs. So if you have any leg pain or heart attacks, blood clots in the lungs, that's in the later stages of COVID treatment. Not treatment. That's in the later stages of COVID presentation. Is sometimes you're sick for a while. If you have any chest pain, shortness of breath, or leg pain, anything weird at all, go to the urgent care. Urgent cares have gotten a lot better, and ERs have gotten a lot better as the COVID numbers have decreased. So it's not as chaotic and crazy and overrun as it was in the first 2 weeks of March. So May, do you have any other? Should I keep talking, or I know we have like 8:20.
Yeah, we can actually open it up. Zara, do you have so we're gonna open up this portion now to the Q&A, the question and answer portion of our program. Sure. And Zara will be able to queue up some of the questions and then can ask one of the speakers too.
Sure.
Cool. Hi everyone, Zara here. So I'm gonna start off with Dr. Alvarez because I know you have a busy schedule. One of the questions that came up is what is happening to kids now in regards to COVID cases? Because I think a lot of things are coming up in the media about impacts on children, some are passing. So one is on impacting children, and the other question was how can they be tested if parents do wish for them to be tested?
Yes. So kids now are so initially they had reported that kids will very likely won't get affected or won't have any issues if they did get it, that they will recover. Now we are finding out that it also can present with an inflammatory reaction similar to something called Kawasaki's, which causes vasculitis and multiple symptoms from a rash, breathing, heart. It affects different blood vessels that affect different organ systems. So, with kids and fever, rash, very common, and they can get very sick, very ill, very fast, and some have died. So, if the kids are having any, fever, rash, any weird symptoms, definitely call the pediatrician. Most doctors are doing telemed if they suspect, COVID-related cases. Unfortunately, I do adults only. I don't do children. So I would say the best answer is to speak to your pediatrician, usually by telemedicine. What was the other question? Oh, testing. So, now, before it was very difficult to test, even in my own office. I have a big primary care office, and we couldn't have testing even for ourselves or our patients. But now a lot of labs have gotten more tests available. So there's Quest, LabCorp, Roche is the best one. But I'm not sure. I don't think it's available widely yet. But LabCorp and Quest, a lot of the urgent cares have them if you want to get tested. Usually, if you're symptomatic, up to 2 weeks, and then if you feel like you've recovered and you want to check for antibodies, we're also testing for antibodies, but they're not terrific. Like the testing still needs improvement, but it's at least better than what we had. Hopefully, those questions. That was one of the questions was testing, correct? Like our office, we test viral load at PCR, and we test antibodies. Most offices are doing that now.
Great. Thank you so much, Dr. Alvarez. The next question I have is for Steve. So 2 questions for you. One was general things that you did in order to manage your health. What health practices did you use, and are there specific medications that were given to you? And then also regarding testing, like in connection to what we just mentioned, when were you tested, and did they retest you post being diagnosed?
I'm not sure if it's the same now, but at the time there were no medicines for coronavirus. But since I did not need a ventilator, I'd need them to do whatever they could do. So in a sense, they tried to. There was one day where they tried a whole bunch of drugs for me. But when I left, they had me on Zithromax, which is antibiotic, and this is by a pill route. But I also, when I started out in the first day, they gave me antibiotics by IV, which was even before I was able to get a bed in the ER. See, what happened at that time was the beds upstairs first of all, the entire hospital of Elmhurst Hospital was was dedicated 100% to just coronavirus patients. All the beds were taken upstairs, and then the beds in the ER were all taken, and then there were about 100 of us who were just sitting on office chairs waiting for a bed. Essentially, I waited many hours in an office chair, as though even before I got a bed, I was given these antibiotics to try to control the fever, and then I was also given the drug hydroxychloroquine, which people are probably not aware. Well, first of all, doctors talk about hydroxychloroquine a little bit differently than what you hear on MSNBC, CNN, or Donald Trump or whatever. But at that time with Elmhurst Hospital, it was kind of standard to give hydroxychloroquine because it seemed to be able to keep your lungs a little clearer. The issue is that the people are always keeping an eye on your heart because, I think I had more than a dozen EKGs because they were concerned about the effect of hydroxychloroquine on my heart. It seemed to me that this hydroxychloroquine did give me a good positive effect. I know that a lot of people did not get a good positive effect from it. I believe I was on remdesivir, but kind of sporadically. So those were the medications. Again, and the doctor could tell you about this, but those medications do not address coronavirus. Those are symptomatic medications, to try to keep your your lungs from inflaming any further, or your capillaries, your alveoli in your lungs from being damaged by your own immune system while the coronavirus continues to spread through your body. And the idea is hopefully that the antibodies within your own body can develop and tip the scale back and heal you of the coronavirus. And so I was very lucky during that entire period. As far as I knew, I was the healthiest person that I had met of all the patients I met. I was probably the healthiest person in the hospital. So much so that seeing everybody else suffering, I actually was requesting to the doctor to just discharge me, because it's sometimes you feel guilty that you're taking up somebody else's bed. Let's just let this bed be empty so that somebody else could use it. But I dodged the bullet. Oh, wait a minute. Can I bounce over a question? I'd like to tell the doctor that, and maybe she's had this experience, that it's very difficult after you're healing from coronavirus, because no one's giving you a straight answer for anything. Like, take, for instance, after I left, I got a coronavirus test. And somebody then called me and said, "You're positive already. You have come out of the hospital. You're still positive. You need to take a test." And so I said, "Well, okay, but am I going to be positive for the rest of my life, or should I come back next week and get a test? I mean, what is it?" And so they couldn't give me an answer. And then with the antibodies, the whole issue is, I said, "Okay, great. I'll take this antibody test. Am I contagious? And am I immune?" And again.
So Steve, it's a big issue.
Oh, sorry, Dr. Alvarez, is it okay if we go back, only because it's connected to what Stephen was already talking about on the medication, the hydroxychloroquine? If we can go back, and because someone was asking if this is something that you would recommend prior to getting COVID. No,
we don't recommend prior
so that
to
was a question
preventative.
Mm-hmm.
Yeah. So, and actually, I can take care of both that question and for Stephen. And I am glad that you got the remdesivir, because people who are so sick, that means that you were super sick. And yeah, I'm glad you got it, because only people in a clinical trial can get it. Otherwise, you're in another trial for like convalescent serum antibodies. And just really quickly about a couple of things about the hydroxychloroquine. The problem is that so the problem with COVID is also it can cause arrhythmia, life-threatening arrhythmias, and cardiomyopathy, myocarditis, can cause the heart function to go from normal to like 30%. And that's how people can get like a heart attack without, having heart disease. So the problem with hydroxychloroquine, and they have 2 studies out currently now. They finally did good studies in America. They had studies in France, and they had studies, I believe it was Japan, that they were using it in other countries too. So, in Stephen's case, Stephen, when you got sick, it was so crazy. We didn't know 100%. I could only copy what other countries were doing. But a lot of doctors here were nervous because they understood the chance of, everything is risk benefit here. We don't want to cause harm. And I'm glad, we kind of put the brakes on it. Everybody was like, oh, even the president was, oh, go buy a hydroxychloroquine and take it just in case. A doctor who owned a med spa in California is going to either got busted because he was selling azithromycin, hydroxychloroquine, like in a pack, in a COVID pack. And, there's a danger to hydroxychloroquine because it can cause arrhythmias on its own. Plus, if you have COVID and you have arrhythmia, then you could also, have a problem that way. So the answer to your question about hydroxychloroquine, I have used it, but I've used it in a very judicious way. Sometimes I do azithro first because azithromycin has less side effects as hydroxy. And I have had patients that gotten better just with the azithro in the outpatient setting. In the inpatient setting, patients are very sick and they tend to need sometimes azithro plus hydroxychloroquine. But in Stephen's case, were able to monitor. So to me, if you can be monitored, there's an online, I'm treating somebody in Texas. Put it this way, I have a patient in Texas. I gave him azithro. He got better, but not 100%. He begged me for hydroxychloroquine. I said, okay, I'll give it to you, but I want you to download and buy this app to be able to do EKGs on yourself at home. And actually, on the third day when we had our follow-up, he told me he stopped the medication because he had 2 abnormal EKGs. So, it's not something to take lightly, but, at the end of the day, if you're desperate and you're sick and there's not other options, it's not I have given it and just monitored my patients. So I don't know if that answers your question about the hydroxychloroquine. It's still in our armament, but there are 2 studies that prove that it is not like a cure-all and it's not 100% safe. So we still have to be cautious and has to be given under doctor's orders and doctor's monitoring. Now about testing is a mess in this country. It's a mess. So, for Stephen, I would definitely still keep checking PCR. So the PCR, unfortunately, it's hard to tell if you still have active virus that you're still exposing other people, or some people are saying if you're asymptomatic for 14 to 21 days, or, I like to say 3 to 4 weeks, sometimes they're calling it presence of dead virus. So, it's really, but, if you want to be on the safe side or careful side, if you can get the testing, it's always good to get it. If it's negative and your antibodies are positive, that means in your body has recovered and no longer has a detectable virus, whether it's alive or dead, plus you made antibodies. Antibodies, whether they mean protection or not, is still up in the air. We are assuming that it has some protection against the person who has it because, obviously we're giving, recovered patient serum to people who are very sick, intubated, but again, that's going to time will tell. If somebody had got it and has antibodies, we'll know over the next few months when more people are out to see if they get sick or not. So unfortunately, again, that's still hopeful that you won't get sick again. And there's so many other things that are happening. A lot of sequela of having COVID is still being identified. There's a lot of things that we're still learning. A lot of people are getting a decline in their lung function that have been infected, 20 to 30%. Some people are getting arthritis. Some people are getting post-infection tachycardia or elevated heart rate. And the fatigue, some people are still getting fatigue that, it hasn't, isn't going away, or shortness of breath. So it's really important to really have a good doctor or primary care or somebody that gets to know your course. That way they can maybe possibly try different things that might help you in the future, like maybe an albuterol pump, inhalers, things like that. So I don't know, hopefully I answered everyone's questions for hydroxychloroquine and the testing.
Thank you, Dr. Alvarez. Yeah, that was a lot of details. We'll definitely compile some of this information that we're also receiving from everyone. The next question is for Louis. If you can just share, similar to what was asked from Steve earlier, if you can share more about your testing experience, how long did it take you, and were you retested after testing the first time around?
Thank you. So I had an extraordinarily negative experience getting tested. Like I said, I've been uninsured. I see someone asking, did I have an elevated heart rate? So the symptoms that I've been feeling with my heart rate was not elevated, but it felt like my heart was hammering, and I could feel it in my chest and I could hear it in my ears. And that made it very difficult to sleep. But back onto testing. At the end of March, the situation was that I had been sick for 2-3 weeks. And while the city was shut down, basically I was told by the city government that all testing would be free for all New Yorkers. I was told by my closest public hospital that unless it was an emergency, that I should not come into the hospital, and I would not be given a test unless I could not breathe or was going to be admitted to the hospital. And I was told by my job that they would not cover any cost of going to the doctor unless I first tested positive for coronavirus, which is kind of a catch-22. How can you get tested if you don't have insurance? And the answer was I crowdfunded the $200 to go to the urgent care. And the $200 was not for the test, it was to be seen by a doctor while uninsured. The doctor told me several times that she would not give me the test. This was not a doctor I was used to. This was at the urgent care near my house. Normally I would go to Apache. When I called them up, they said that for their entire caseload, they were given 5 tests. And they are a public clinic in Manhattan. And so I went to urgent care. I paid the $200. I called my doctor from the room in the urgent care. They complied with my doctor's wishes to do a chest x-ray and to take my vitals. They fought me to test me, and I burst into tears in the urgent care room because the doctor told me that she didn't want to waste supplies testing me, and that she was concerned for her kids, but she had to suck it up, so I should suck it up. And that's when I, while having a fever in the urgent care, called my doctor, and my PCP was yelling at this urgent care doctor from the urgent care room. And that is when the urgent care doctor tested me. My test came back negative, and I was very confused about that, but my PCP talked me through it, and I've been diagnosed with COVID-19 despite my negative test, as well as pneumonia based on symptoms. From what my PCP has told me, and I am not a doctor, there's about a 30% false negative rate on the COVID test. It took me 2 weeks to get my results back. I was very adamant about being tested because at the time I wanted to warn my twin sister, who was a nurse, who I'd been in contact with, as well as all the people who I'd seen at my job. So my current test is negative, and it cost me $200, and I am not in a huge rush to get tested again, considering that a doctor basically insulted me and told me that it was not worth it to test me. So that was my experience.
Thank you, Louis. Again, we will share more information about Louis as well, and all the information he shared earlier. One last question before we close out. This is for Aris. If you can tell us, so someone was asking about what hazard pay is, and if you can just kind of talk about that, please.
Sure. So my understanding is in the bill, they're hoping to add some money to frontline healthcare workers. This is a thing that the Democrats have been asking for. Unfortunately, I don't have too much detail on the hazard pay right now because it's a new bill, but it's basically their way of trying to compensate people more for the risks that they are taking during this time.
Great, thank you. We don't have enough time to actually answer any more questions, but we do have, we want to stay in contact with folks. We are going to compile some of the information here that we are hearing from all our guest speakers. We also have this video up online, and for folks who, if you want to share it with family members and friends, you definitely can ask them to, look at this video again. We are going to have it up. It's also going to be available in YouTube, just like what Mike had mentioned earlier. So we definitely want to thank all our speakers. We want to thank Aris, Steve. We want to say thank you to Dr. Alvarez. I know she probably just signed off right now. And of course, Louis, for sharing and sharing your hard experiences to all of us. Never easy to do that. So we are now at the end and are closing. Please do stay in contact with us. There are different ways to volunteer with us. You can be part of our different committees that exist: research and education services, action and advocacy, resource mobilization and outreach. So you can be part of any of those committees, or just stay in contact and be part of NAFCON, both as an individual or organization. We also have a link for all of you guys to follow if you do want to donate. As mentioned earlier, we have ongoing projects that we have under the Bayanihan response to COVID. So please visit our website, visit us in Facebook. We have different social media formats. We're also in Instagram. We are in Twitter. And so stay in contact. We will send information to everyone who actually got on today, everyone who signed on and had emailed us also. So do follow us in social media. And once again, we want to thank everyone, all our guest speakers. So thank you, thank you all for staying tuned. And we do have another webinar, because this is a series. We have another webinar that's coming up. I know Tita Soki is actually here.
Sarah froze, but we are closing out. And that, Mike, could you give a quick announcement of what's to come?
So our next webinar is in about 2 weeks. We are going to be doing one on holistic and mental health. So we're going to have someone come in. Soki is going to actually come in and talk about the holistic health, and then we're going to have a psychologist talk about how we can take care of ourselves during these times, especially if we're going through some challenges. It does affect us with anxiety and whatnot. So we're going to actually have someone give a brief discussion on how to deal with that. And then after that, the next one on I believe in June, we're going to have one on unemployment. So please stay tuned for that. Always, you could always check up our website, and feel free to contact us at nafcon.ne@gmail.com. All right, everyone, have a great night. Again, thank you and be safe.